You.
And
Wonderful.
it's recording now.
Okay, great. Well, I'll start us off. Hello, everyone, and thanks for joining us. We're here today to conduct an interview with our very special guest, Dr. Stephanie Gangemi, Assistant Professor in the College of Public Service, the Department of Social Work at the University of Colorado in Colorado Springs. Stephanie, welcome, and thank you so much for taking time out of your busy schedule to join with us today. The purpose of this session is to conduct an interview with you on the topic of what effect certain Colorado legislation has had on the public health issue of gun violence in this state. We'll be discussing two laws in particular, the Colorado Revised Statutes and the Colorado Red Flag Law, otherwise known as the Extreme Risk Protection Order. My name is Dave Conrad, and I'm a master's candidate in the School of Public Health at the University of Colorado Anschutz Medical Campus, and I'm a member of a student group of similar master's candidates who have the pleasure of interviewing you on these topics today. I'd like now to turn it over to the rest of the group to perform their introductions and begin the interview.
Hello, Stephanie. My name is Fatima Pacheco. I'm a professional research assistant at the University of Colorado Anschutz Medical Campus, and I'm very excited to have you here tonight.
Hi, Stephanie. I'm Kristen Herrera. I'm also getting my MPH at the Anschutz Medical Campus. I am in the Global Health Epidemiology program.
Hey, Stephanie, I'm Davin Boykin. I'm also an MPH student at CU Anschutz as well. And yeah, I work at Denver Health and I'm a Denver resident.
Hi, Stephanie. My name is Justin Lorenzen. I'm also a MPH candidate, and I am in the epidemiology concentration.
Thank you, Stephanie. I'm going to start asking the first question. It's not a question itself. It's more like we want to learn more about the agency or organization that you work at, the populations that you serve, and your role in the agency.
Great. Thank you. Well, thanks so much for having me. It's nice to hear from you all. So as you mentioned, I am an assistant professor at University of Colorado, Colorado Springs. I teach in the social work department. We're the only school in the CU system that has a social work department. We're very proud of that fact. We launched about 4 years ago. And the populations that I serve there, we have about 12,000 students of largely non-traditional students, military affiliated students. And then in my part-time job, I'm a trauma therapist and treat people for a range of mental health issues that they're facing. Worked in corrections for 10 years in the jail environment. So worked with people who were gravely disabled very often and needing M1 hospitalizations, that sort of thing.
Perfect. And how do you and your agency promote or participate in policy efforts in our challenging political climate?
Yeah, it's a good question. I think we sort of have when I think about it, I think there's a three-pronged approach. I mean, we're a school, so obviously our first prong is education, and really in social work is very social justice and social policy oriented. So helping students understand different social policies and understand the implications of them, helping students come up with their own ideas about different social policies, and also helping them push their boundaries of what they thought and trying to expand their way of conceptualizing things. We do wind up with a lot of students who are coming just out of the homes that they grew up in, and helping them see that there's many different sides and opinions and arguments and data that affect decision making. I think the second prong is advocacy. So there's some members of our faculty and our student population that are working on gun advocacy right now. Several of them were up at the Capitol last week testifying on Senate Bill 24-131. There's also a chapter of Students Demand Action. So trying to make moves at the policy level through legislation regarding guns. And then we're an educational institution, but we also provide treatment. So there was mental health treatment provided by the university in the form of crisis counseling, longer term treatment, awareness about mental health crises. And so that's sort of the major, I'm sure there's many other ways in which we try and face the political climate, but I think those are some of the ways right now.
Perfect, thank you.
Okay, Stephanie, I'm going to ask you, what do you believe are the best mechanisms regarding this issue to reach the community and those most impacted and get community engagement and buy-in about the issues.
Yeah, thank you. I'm so thrilled to hear you're a lot of public health people because my first idea about this is the importance of really reframing gun violence as a public health issue and not looking at it as just an issue, a politicized issue of like how we all have to defend ourselves at all moments. You know, it's the data suggests, obviously, or not suggests, I think the data is pretty conclusive that gun violence is a public health issue. And so I think the mechanisms regarding this are understanding where gun violence is more prevalent, having that data, using the data, having long-term ways of measuring data. I think also like really understanding the preventability of gun violence. I think that's a very American argument of like, it can't be stopped. There's nothing we can do with this current epidemic, but knowing that it is preventable and that there's things that we can do as communities, as a country to address what's going on. I think obviously not all gun violence is related to mental health issues, but a lot of it is, and having better supports in place for mental health services so that they can have sort of early intervention for people who are at risk for gun violence against others or suicide, obviously, which is, especially in Colorado, such a massive challenge that we face, and firearms are the main culprit in that here. Let me just look at the question again, if that answers the best mechanisms. Yeah, I think for buy-in, it's a lot of this education, like really pushing back on the narrative that it has to be this political thing of left versus right, red versus blue, and bring it back to like the need for this public health approach and resolving it, addressing it.
Yeah, I really love that answer. I think that was awesome. And I agree with you on every point that you made. So yeah. And I'm glad that we're able to like learn about these things in our classes and in our school. So, you know, we are made aware that this is a public health issue and not just a political issue. So yeah.
Once I get
Awesome.
tenure, I want to go to the MPH program with my tuition benefits. I'm like dying to do it because I'm just like obsessed with public health. I think it's so important.
Okay, for my question, what ideas do you have for development and implementation of interventions that can help the community and those most impacted by this issue?
This is, I think, one of the harder ones when I was thinking about these questions. And I certainly I am not an expert on guns, like not at all. But when I think about what interventions would be most helpful, I think a lot about the treatment side. I think a lot about actually, let me back that up though. I would say like the first and foremost is like these community education programs about like, we're not just trying to come to your house and raid. The government is not trying to steal everyone's guns, like taking a more educating a more common sense approach to like looking at violence rates. And so I think there has to be this like public service campaign about what are the facts regarding gun violence and responses to guns. And then I think like these making a healthier society, which feels really daunting to say out loud, but also feels really essential. Like there are communities that have like essentially no gun violence, and how can we learn from what those communities are doing? And then there's communities that have like some of the highest suicide rates in the state and in the country, you know, of which Colorado is always high up there. And so how can we change the culture of different communities that are more heavily impacted by gun violence? And through that happens in a lot of ways, right? Like reducing socioeconomic disparities and increasing access to supports and services for families that are struggling, and navigating complicated dynamics related to the isms, race, gender, age, all of that. So that's where I would start, but I'm sort of glad I'm not in charge of that because that seems like a very heavy, I'm so glad you all are on this cause because yeah, I think so. Every community is going to need to do that really differently. I'm trying to think if there's anything else I would add to that, just implementation of interventions. I know the next few questions are about red flag laws, so I'll talk about that there, but seems pretty essential. You see like case after case where it's like, oh yeah, the warning signs were all there. And how many times even there were warning signs, but nothing did happen. It doesn't mean nothing should happen, right? Maybe something should happen even though the worst case scenario didn't come to be. And so I think things like red flag laws are a way to get closer to that.
I,
And
I
there's
really liked the term healthier society, honestly, because I think America needs a lot more of education on that and building healthier and safer societies that can help some of these gun violence problems.
it's so hard. Like I think there's the narrative of this like deranged lone wolf person, but those are the ones we see in the news, like in the big media. But ultimately, I push back on the narrative of like all of these people are grappling with mental illness and we're failed by the system. It's not always the case, and it's like this is a cultural problem that we have here.
Yeah.
And that's why I liked when you mentioned education as kind of one of the first steps, because I feel like that's so important when you enter the political arena. Everything, and not everything, but it seems like a lot of things in public health, COVID, vaccines, the gun violence, it's all getting politicized. And I mean, I really don't know of a much better way to get around that than just kind of keep hitting the education button as many times as you can.
Totally agree. Yes. Yeah. I was talking, I was thinking about COVID. Like, if we politicize COVID, like, of course, we're politicizing guns and how I believe we can do this. Like, I want to, like, I have faith that these things can be done. I'm glad you all are on this cause. But the need for education, I think, is the biggest thing.
Yeah. So for my question, it'll revolve a little bit more around the Colorado revised statutes. So the revised statute 2911.7102 states the following. Oh, perfect. Thank you. A local government, including a law enforcement agency, shall not maintain a list or other form of record or database of persons who purchase or exchange firearms or who leave firearms for repair or sale on consignment, persons who transfer firearms unless the persons are federally licensed firearms dealers, the descriptions, including the serial numbers of firearms purchased, transferred, exchanged, or left for repair or sale on consignment. What impact do you think this law currently has on gun violence in Colorado?
I thought this was the hardest question of the bunch. And I spent some time thinking about it, and I, I am answering this strictly like in opinion. I don't know the facts. I haven't researched uh, the realities of this necessarily. But my sense is that the biggest, the first thing that comes up for me, having worked in corrections, is just like the barriers to criminal investigations that come. I don't know how, I don't know if changing this would decrease gun violence, but it certainly seems like it's a lot harder to understand gun violence and to track gun violence and to respond to crimes related to gun violence without this sort of information. I think it obviously would like makes it easier to have like illegal transfers happening. It's just like I was listening to a podcast the other day where they were talking about, it was like Dateline or something trashy, and they were talking about like the little things that stop people from doing crimes, like a camera and a sign that says we have a camera, and like just these smaller things that like if you have to go through 10 of them, it makes it less likely for you to like go down that road. And this I sort of think about in that same way. Like why make it so easy? Like why not just put a few extra barriers in place? I think it also probably makes it really hard on the stats people and the data people to fully understand what's going on with weapons and who has them, what communities have more of them versus others. Just keeping tabs on that seems harder. And then like, probably the last thought I had was just like I have to register my car. I have to register my dirt bike. Like they know the name, I mean, number of my dirt bike. They every single year they send me my, I have to put my stickers on it just to go to the park. A gun seems like a lot more of a higher stakes item for the state to be tracking than my dirt bike that gets taken out maybe once a year if I'm lucky. Um, yeah, so that's sort of some of the thoughts I had on there.
Yeah, I agree completely about the stats part of your answer. That was the first thing I thought of in regards to these statutes, and having more of this data would allow us to, target our efforts on where we need to have more gun violence prevention efforts included. So I really like that part of your answer and fully agree with it.
Thank you. And I think another podcast, or I listened to the podcast about the Gilgo Beach killer in Long Island. And, something like that happens. And they're like, let's track all the people who had this kind of vehicle from 2000 whatever to 2000 whatever. And they are able to solve these like cold cases with this information that happens. So I don't know. I don't know how essential that would be. I can't speak intelligently to that, but common sense tells me having that data doesn't cause any harm, right? Like, what's the harm? You register your car, you register your dirt bike. What's the harm in just having that? And if you need it later. So it's helpful to hear that that makes sense to you guys too.
Yeah, it was very surprising to me how little regulation there is like in Colorado for like guns. And it seems to me that it makes sense, as you said, like you have to register your vehicle, you have to register your bike. Why not guns? Which is like we have this issue like gun violence, and why not register your gun? It's easy.
You're supposed to register your dogs, which I have not, so don't snitch me out. But you have like legally you have to register your pets and get a pet license. Like, so yeah, I'm breaking that law, but there's nobody is that threat. My dogs are little, they can't bite and harm anybody. But you know what? If they could, then that would make a lot more sense.
Yeah.
And if there's like there was a big dog disease that went around this year. So now I'm talking myself into why I should follow that law. But I think if it became that important, right? If 100 school kids were being killed by little French bulldogs and someone said register your dog, I would go register my dog, right? Like
Yeah.
just as a citizen of the world, I would do that piece.
And again, unfortunately, this conversation has been framed for a long time in terms of the political leanings, constitutional rights over public health, and where you see there's a lot of people that are just opposed to registries of any kind because they're afraid that big government's going to start tracking them, and big government's coming to take away your guns. And it's my right to do what I want with my guns, and nobody should know what I have or how many of that I have. And, just completely oblivious or don't care about the public health and safety impacts of those behaviors. So it feels like we're always fighting that unending battle against the tide of the Second Amendment. And it just, I mean, it's going to be a very difficult slog to convince the majority of the people that are really opposed to that it's actually in the best interest of public health and safety for them to get on board and agree to have some more common sense, not just registry kind of ideas, but just common sense gun laws in general. And
Yeah, I
that's
love
speaking
that
from
term.
somebody who's been in the community for a long time. I'm a former firearms instructor and competitive shooter, so I've had to deal with this conversation over and over many times. So I'm very familiar with the people that take those arguments against gun registration and having more of a database.
That message coming from, I think, people who are comfortable around guns, like firearms instructors, like I think that is such a powerful argument too, like in that ability to advocate for like this term common sense is like, I love that, even though, nothing common about common sense, as we say. But yeah, I think that's powerful that you're able to use your voice on behalf of this.
Okay, well, let's move on to the final question. And this is about the extreme risk protection order. I'm sorry. So, as I'm sure you're no doubt aware, back in April of 2023, the state legislature passed an update to the original extreme risk protection order, including or expanding rather the people that are able to file those red flag reports. Previously, it was just law enforcement and family members, and this most recent update has expanded that to include medical workers, mental health workers, and also educators. So my question to you is, what are your thoughts on the new expansion of the red flag law? Do you feel like it is what people were looking for in terms of specifically of mental health? And do you feel like those laws go far enough, or would you like to see some kind of expansion or continuation of that?
Yeah, this was another hard one and I also really like this question, it was fun. Thank you for asking these questions because they gave me a lot to think about. I think these laws are really important. There's so many uh, ways in which we have to like we're each other's keepers out here, right? And like especially in the mental health realm, we are responsible for doing M1 hospitalizations when people are a danger to themselves or a danger to others or gravely disabled. And every clinician I know takes that very seriously. And I think the ability, it is increasingly a critical function of many people in society, whether it's law enforcement or mental health professionals, or I know they were always saying like the dog catcher can do an M1, right? Like it's the role of all of us who have joined the helping professions to help to take this seriously, especially as gun violence becomes more and more of an issue. And so I think I think these laws are important. I think they're valuable. Do they go far enough? I think it's not necessarily in my mind, do they go far enough, but like, are they happening enough in tandem with the other things that have to happen? Are they happening in conjunction with education, in conjunction with data collection, in conjunction with mental health services and supports being put into communities? So that's sort of how I would define whether or not it goes far enough. And my guess is we can always do much, much, much more of those. And my sense is like so many things, we sort of pass the legislation and then start to make sure that we have all that infrastructure in place, and that we have a long way to go with that. But we know that restricting access to lethal means decreases suicides. We know that it decreases homicides. We know that these sort of then bring people onto the radar of the folks who want to keep communities safe, right? Ideally. So I think in those regards, I'm glad that these laws exist, and you have to start somewhere, right? And it's I think I always worry, okay, yeah, we can have the red flag law, take the weapons, and then nothing is in place to help people and they just sort of fall off or they get caught in legislation and have to get an attorney. Like that's not what we want. So I think just making sure we have that infrastructure. I think the other part of this question was it the what barriers exist to the utilization of the red flag laws? Is that right? Do you need that answer?
And specifically, it's comes down to the utilization of that and what kind of potential issues would come up with as far as people not wanting to take advantage of the red flag laws. I was reading an article on Colorado Public Radio about some interviews that they had done with some folks specifically in the education arena, and there was a kind of across the board hesitancy for any of the educators to kind of dip their toes into the red flag laws. They were afraid of reprisals or other things, and afraid of not being supported by the Denver school district. Um, in fact, I'm quoting here that Denver Public Schools was not training teachers about their new ability to file red flag petitions, despite the city of Denver's overall embrace of the red flag law. So I guess when framing that question, that was kind of the thought that I had was, as a mental health professional, do you see there are a lot of potential barriers, maybe from an emotional or professional standpoint, to people utilizing this? And how maybe could we break that down a little bit to allow people to feel more comfortable utilizing the new law?
Yeah, this is real. It's interesting to hear that. It's like partially disheartening and also partially so under like knowing this world that we're in. I totally get that. Um, yeah, I think the more education that teachers, mental health providers like have about these laws, the easier it becomes to enforce them and to feel comfortable using them. Like it's no joke to do an M1 hospitalization, right? To take somebody's freedom away. Like they might lose their job, they might lose their pets. Like I think we all take that very seriously and we get a lot of training in the realm of how to make those and there's directions that we can head in to know like when is it time or when can we consult about doing that. And I think something like that, I haven't seen anything like that come my way as a clinician, but I'm not practicing full time. So I don't know if that's happening in the mental health world as much as it could be. I think that would help. We're like, one of these barriers is obviously the litigious nature of our society, that as soon as something happens, nobody wants to be sued. Like nobody wants to be the one who gets branded as like the anti-Second Amendment person. Not nobody, I'm sure some people are totally fine with that, but it's so polarizing that it's not their first choice. But further, clinicians, teachers, nobody wants to be sued, school districts. So if you like make that call, what are the protections in place if you're doing things in good faith, the way we have certain protections under M1, making M1 hospitalizations for people? And the one piece that I cannot get my head wrapped around, I can get it, is this like the barrier from law enforcement. This is like so stunning to me, especially like the political law enforcement offices, like sheriff's offices. Like my colleague was up doing that testimony the other day, and she said like the sheriff's offices just kept saying that they need citizens, essentially, I'm paraphrasing, but citizens should be able to be armed because they can't do their job. Like there are too many guns out there, they can't all do their jobs, and so they need an armed community to be able to help. And like, when does somebody say like we have gone so far off the rails, and how do we like remove the politicization of law enforcement organizations so that they can actually use common sense? I'm sure the average cop on the street is not like, this is great, we love having everybody armed to the teeth with AR-15s, like love this for us. Like it just doesn't make sense. And so how do we separate out that political piece? I don't know the answer. I think different communities that have less of that probably have those answers in a more articulate way than I do. So that's yeah, those are sort of how I see those barriers. Like when can helping professionals work together as helping professions to help, instead of like getting lost in the politics of all this and the divisiveness of this one litmus test thing that has to do with like dividing us collectively. So I don't know if that answers that question or speaks to that question fully.
And I think you definitely hit on some really important points there. The one thing that I kind of thought of when I read that quote to you earlier, I've kind of read this article a few times, and the question that always keeps coming into my mind is, in order for people to feel comfortable using this red flag law, I think they need to feel supported, like institutionally supported. If you're a teacher in the Denver school district and you know the district is kind of even behind closed doors frowning on your use of this, you're much less likely to take the chance and use it, knowing that you don't have any backup. I imagine the same thing probably exists in the medical profession and in the mental health profession too. Is like, if you don't have that institutional support behind you, you're much less likely to stick your neck out. So I wonder if maybe that has some impact. And I don't really know the situation behind the scenes as far as that. I didn't do a deep dive into whether that's actually occurring or not. But it seems on the surface to me anyway that that would be a potential reason why people would shy away from using this expanded red flag law, because they just don't know how their bosses are going to support them in that.
That's such an important point. And my research right now is on moral injury in healthcare workers and in law enforcement. So when law enforcement is, and these folks are uh, doing or not doing things that violate their moral code because of sort of societal or institutional or leadership pressures, like this betrayal of what's right by people in authority in a high stakes situation. And they talk about how moral injury is a public health issue in the healthcare and law enforcement professions, and how we have to use this public health approach. And part of it is like building moral courage, building this structure in organizations where people can stand up for it. And so like I'm outspoken, I'm from New York City, I worked in jail for 10 years, so I don't mind saying things generally. I'm like, whatever, I don't care. But that came from like cultivating that culture and being and having some successes doing that. So how do we instill in other, whether it's teachers, clinicians, law enforcement officers, like a moral courage that lets them stand up and say like, actually, this doesn't make any sense. And actually we have to go, like, we have to enforce this law in this case. And so that maybe they get blowback, but if there's many other people or if they can create an infrastructure at their organization so that they know who the safe people are, who is going to advocate for them, so that they even know what a legal process is going to look like if it gets challenged. Nobody wants to be those first few people getting sued over a red flag law. But yeah, I think that moral courage would help everybody do that common sense piece that we all like really understand is essential.
Exactly what I was thinking.
Well, thank you so much, Dr. Stephanie Gangemi, for taking the time out of your schedule this evening to meet with us and doing this interview. It was great to get to know you further through the short time together. It's interesting to know that you're from New York and all of these different aspects. We obviously appreciate your input and information that you could provide us with about gun violence. And we appreciate your passions for the topic and hope that with interdisciplinary actions, we can tackle this public health issue together. So thank you so much again.
Well, thank you all so much. Thanks for doing this important work, and thanks for letting me weigh in. And I look forward to seeing what comes of all this. Thank you so much.
Thank
Absolutely.
you. Have a great evening.
Thank
You
you.
too. Bye-bye.
Bye.